So the Eustachian tube sits in the back of the nose, all the way in the back of the nasopharynx and off to the side. So here you can see in this diagram, the upper third is embedded in the skull, and that's bone. That part does not open and close. So the functional part is the cartilaginous portion, the lower 2/3 that opens up into the back of the nose. And it has a cartilage skeleton that is the spring of the Eustachian tube valve. That's what closes it. So when we swallow and yawn, that's when it opens. And so when we do the clinical exams with an endoscope in the nose, we have them swallow and yawn to see how well the valve is opening. So the reason many children get ear infections is that there's inflammation in the valve, and it's swollen shut. There's adenoid-like tissue, just like we take out the adenoid next to the Eustachian tube. There's adenoid-like tissue inside the Eustachian tube that can get blocked. Or allergies can cause chronic inflammation. But as we just talked about, chronic allergies can actually ultimately cause some atrophy in the valve. And so if the valve has a leak in it, that's going to be a patulous. The leak could be due to, this is a cross-section of the valve there. It could be due to a atrophy in the mucosa or submucosa. It could be the rapid weight loss and they lost fat. It might be that they're missing some of this cartilage, particularly if you have a thin build. And muscle tension, if they're clenching their muscles, tense, stress, anxiety, temporomandibular disorders, that muscle tension can pull it open. So these are all the things that we look for and try to treat.